Tzield is used to help slow down the progression from stage 2 to stage 3 type 1 diabetes. Type 1 diabetes is an autoimmune disorder where your own immune system attacks and destroys insulin-making cells, beta cells in the pancreas. Tzield helps to prevent the immune system from attacking the beta cells, which may help slow down the progression of type 1 diabetes. Tzield can help patients stay at stage 2 for longer, meaning that patients can spend more time symptom-free without the complication of needing insulin injections. Checking blood glucose levels regularly and the risk of diabetic ketoacidosis, which can be life-threatening. How to use. Teplizumab is a solution injected into a vein, intravenous infusion, over approximately 30 minutes. You will receive this medicine once a day for 14 days. Before starting this medicine, you will have a complete blood count and liver enzyme tests. You will be given other medications to help reduce side effects of fever, headache, muscle and joint pain, or nausea. Medicines may include ibuprofen, naproxen, or other pain relievers such as acetaminophen, and an antihistamine and an anti-nausea medicine. You should receive all appropriate vaccines before you start using this medicine. Live-attenuated vaccines should be given at least 8 weeks before Tzield treatment. Inactivated vaccines should be given at least 2 weeks prior to treatment. You will need regular blood tests before and during treatment with Tzield. Your treatment may be temporarily or permanently discontinued if you have certain side effects. Usual adult and pediatric dose for delay of onset on stage 3 type 1 diabetes. Tzield is given by intravenous infusion over a minimum of 30 minutes, using a body surface area-based dosing once daily for 14 consecutive days, as follows. Do not administer 2 doses on the same day. Contraindications. Tell a doctor if you have a serious infection or an infection that keeps returning or does not go away, or recently received or are scheduled to receive a vaccine. This medicine may affect how well a vaccine works. Tell your healthcare provider that you are receiving treatment with this medicine before receiving a vaccine. Precautions. Before using teplizumab, tell a doctor or pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist a medical history, especially of blood-bone marrow problems such as low red white blood cells and platelets, liver disease. Teplizumab can make you more likely to get infections or may make current infections worse. Stay away from anyone who has an infection that may easily spread, such as chickenpox, measles, flu. Talk to a doctor if you have been exposed to an infection or for more details. Side effects. Serious side effects can occur with Tzield. Cytokine release syndrome is a serious side effect that may occur during the first 5 days of treatment. Tell your healthcare provider right away if during treatment you develop any of the signs and symptoms, feeling unusually tired, fever, headache, nausea, or muscle and joint pain. Decrease in white blood cells. This medicine may decrease the number of a type of white blood cells, lymphocytes, that can affect your body's ability to fight infections. Liver and complete blood counts. Your healthcare provider will do blood tests to check your liver and your complete blood counts before you start treatment and during treatment with this medicine. During and after treatment, your healthcare provider will check you for serious side effects, as well as other side effects, and treat you as needed. Your healthcare provider may temporarily or completely stop your treatment with this medicine if you develop liver problems, have a serious infection, or if your blood counts stay too low.